inside exercise to strengthen your pelvic floor is the subject of this video, so stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. If I only had 5 minutes to invest in strengthening my pelvic floor for pelvic floor dysfunction symptoms, I would spend 3 minutes of it in my breathing, and I'll show you how that's done. And the rest, I would work on engaging my inner thigh with my glutes to track my legs or my thighs, my lower extremities, which is a common thing that's happening from my perspective, which is stability of the pelvis with regards to pelvic floor dysfunction, and something that doesn't happen as often when it comes to the world of pelvic floor therapy. So when it comes to breathing, I go ahead and place your hands on your chest, on your the bones on the side on your chest, and breathe in through your nose. Think about your diaphragm with the process of breathing in going towards the floor as you push your rib cage out. So you're breathing in and think about pushing your rib cage out. So your hands should feel like they're going outward. So you practice that a couple of times. Let's just go ahead and do that. Again. As you see, my chest is not rising and I'm not doing none of that. That's dysfunctional breathing. That is not what biological breathing is all about. So practice that, then move your hands a little bit lower so it's more in the curvature in your side, and then finally place your thumbs on the back portion of your waist and the fingers in the lower part of your pelvis, right above the hip joint. And in the process of breathing in, you want to be able to feel the inside of you pressing your fingers outward and your thumbs outward. Make sure we're dispersing that pressure. We don't want to breathe in and feel it like pushing through our vagina or penis. That is not what biological and correct breathing is all about. This is so important. You can do that laying down with your knees bent, with your spine touching the floor, and practice that. That's the easiest. Second easiest is when you're sitting and finally standing up. That is so, so important. And that's like a power on button on your computer. Regardless of what softwares you have on your computer, if you don't turn the computer on, you have no access to it. So that's the first one. And then the other one that I really like is squatting. So you can do just the standard squatting or the sumo squatting. So standard squatting is when you're hip hinging forward and you're bending down and keeping your knees in place. So in the process of bending down and coming up, your knees don't go in and out. If you like, you can place your hands on the inside of your thighs and you're pushing out with your hands as you're meeting equal amount of force by your legs exerted onto your hands. So the legs pushing into my hands and the hands pushing out onto my thighs are equal as I hinge, bring myself up and down. And in the case of sumo, not sumo wrestling, sumo squatting, you're spreading your legs, you are lowering yourself without letting your knees go in and out, and you go down. We've done a video on just this subject, and we'll make sure that we put it at the end of this video in case you need to get more detailed information as to how to do proper sumo squatting for pelvic floor dysfunction. If you have not done so, this is a great time for you to subscribe to the channel. Use one of the methods of contact in the description box to contact me with any questions you may have. Until next time, take care.